Most of us see a doctor for just about any ailment, but for men suffering from sexual health problems, they rarely talk about it, let alone see a medical expert. Here at the Vital Male of Scottsdale, the all-male staff ensures your privacy so the dialogue can begin. Well, we are talking about it today with Dr. Mark Weiss from the Vital Male in Scottsdale. Good to see you. We hear the term impotence often used, but you say there are health dangers associated with ED. What are they?
Well, that's correct, Susan. We don't use the word impotence anymore because it's considered a pejorative, and ED, or erectile dysfunction, is not a man's fault. It's caused by medical problems. Erectile dysfunction is where a man is incapable of completing intercourse. And one of the major things I want to drive home to the audience today is this is nothing for a man to be ashamed of. The most likely cause is circulatory problems. And what I mean by that is if you're having blood flow problems to the penis, then you are probably having blood flow problems in the rest of your body, specifically your heart, your neck, your brain, or other parts of the body.
So what could that lead to?
Well, what that means is in our testing process here, we do a very thorough testing process, and on occasion what we find is somebody who has significant enough atherosclerosis that instead of starting them on one of our treatments, we march them across the street to the heart specialist to prevent the heart attack or the stroke that they've been working on. And that's one of the things that we're proud of. So not only are we working day and night to help improve people's lives, we're also helping save people's lives. Men don't like coming to the doctors, and they also don't like talking about things that they're anxious, nervous, or ashamed about. So the best way to get men here is to have their women bring them here. So ladies, please grab your men by the scruff of the neck and bring them down here, because not only are we going to help improve your relationship, we may save your husband's life.
So can you talk to us about the treatment programs that you have available here and other services you provide? Sure.
Again, we treat men's sexual health problems, and one of the things that makes us special is we have a systematic process where when men come into us for any problem, we take them through our process of a thorough medical history, physical examination, laboratory testing, and other diagnostic testing that tells us exactly what their problem is, exactly how to treat it, and by knowing those two things, we can promise great results. Our success rate here is in the high 90s, and one of the things we're proudest of here as relates to our erectile dysfunction, 46% of our men who complete our 12-month program no longer need any kind of medicine for ED. As far as premature ejaculation goes, the same treatment program for our ED program is the one we use for our premature ejaculation program, and we have tremendous results with that. The other things we do is we treat low testosterone issues, and we treat male size issues as well.
Alrighty, well ladies, you heard Dr. Wise. Pick up the phone and call today. Here's how you can get more information about the Vital Male. The Vital Male of Scottsdale has a special offer for you. The first 25 people to call and book an appointment today will receive a free consultation and $200 off any treatment package. The Vital Male of Scottsdale is located at 11,000 North Scottsdale Road, Suite 145. Call 480-998-4825 or visit their website at thevitalmale.com. Ladies, we go to the doctor for all sorts of conditions and ailments, but men rarely see a physician, especially to address their sexual health. Here to talk about why an increasing number of today's male population are suffering in silence and treatment options is Dr. Alex DeSolaire of the Vital Male. So great to see you. Tell us about your clinic. What is the Vital Male?
Okay. Well, first of all, Susan, I want to thank you for having the courage to bring us on your show to discuss this serious topic of erectile dysfunction, which is considered ED, and premature ejaculation, which is known as PE. But at the Vital Male, we offer, not only do we offer weight loss and aesthetics, but we're mainly operated, it's a male-operated staff, as well as the thought process behind everything. We offer a safe and comfortable environment for our patients that are experiencing ED and PE.
And when they come to you, again, it's all men who work here because you know, and we've discussed this very frankly, to talk about this topic is often taboo. A lot of people don't like to discuss it. But what I found interesting when I was learning about this, ED, it's a health problem. It is not, you know, should I say, a man not being man enough,
right,
if you will. This is a health concern.
Right, that's correct. So ED is mainly caused by physical problems. It's not caused by, you know, not wanting to do the act. So the physical problems mainly stem from circulatory issues. So if you have a circulatory problem, for instance, if you're talking about arteriosclerosis, which is hardening of the arteries, or high blood sugar levels, which is diabetes, or hypertension, which is high blood pressure, then you're more at risk, or you're jeopardizing the function of your male sex organ, and you need to come in and get evaluated.
Right, so you're doing more than just maybe saving a marriage. You're in a lot of cases saving lives in some instances.
That's correct.
And I'm sure men are shocked when they go in, and because you do a full battery of tests?
Right, we do. We do a comprehensive evaluation, and basically the test allows us to see exactly where the problem is and what type of treatment we can offer. So, and a lot of times we'll have a patient that comes in and that wants treatment, but unfortunately because we find that he's more at risk for, say, a cardiovascular issue such as a stroke or something more severe, then, you know, we end up having to refer him out to a specialist.
And I also understand, and is it true that low testosterone in men, it also kind of brings up another set of health risks? What are those?
Absolutely. So there are two major health risks associated with low testosterone. So the first major health risk is when the patient is currently experiencing, say, some symptoms such as irritability, lack of concentration, depression, fatigue. Now, the second major health risk is associated with future complications that may arise, which can include increased risk for heart attack, stroke, osteoporosis, dementia. So these are major issues and concerns.
And I know the Vital Male also offers male enhancement. Why would a man want to do something like that?
Right, that's correct. And the obvious reason for the obvious reason would be for enlargement of the male sex organ. But besides that, our procedure offers a rehabilitation to the area, allowing for improved blood flow, which improves erectile dysfunction as well as your sex life.
So it kind of goes together.
It goes together, hand in hand.
Well, the Vital Male has a special summer offer for $199 a month. Men will receive low testosterone replacement therapy, including pellets, cream, as well as injections. Plus, they are offering ED treatments for the same price, which includes PE treatment if desired. The Vital Male is located at 11,000 North Scottsdale Road, Suite 145. To book an appointment, call 480-99-VITAL. That's 480-998-4825, or you can visit their website at thevitalmale.com.